I'm Dr. Steve Segal, and today I'm with Dr. Scott Jacobsen up in Libertyville. He's a podiatrist up here, and I got to meet him a while back. And one of his first questions to me was, well, Doc, how do you view podiatry? And, does it play a role in how you practice? I said, look, Scott, I have an 80-foot exam room by the time the patient gets from the front door back here. So I already have an idea of how the feet contact the ground, look at the knees, pelvis, hip, low back, and you can even get some information up in the neck. So, Doc, I'm excited for him to be here. Thanks for taking time out of your day.
I appreciate it.
And hanging with me. So, as a podiatrist, can you tell me a little bit, tell the folks a little bit about what you do?
As a podiatrist, we treat disorders and diseases of the foot and ankle. It can be anything from ankle sprains to heel pain to ingrown toenails to full-fledged reconstructive surgery. And our specialty is foot and ankle. Yeah.
Cool. How'd you get started in podiatry?
Well, I always wanted to be a shoe salesman, but my mom wanted a doctor in the family. No, I'm just kidding. When I went to school at University of Iowa, I did a lot of research, and it seemed like a nice field as far as well-roundedness, doing a little surgery, a little medicine, a little bit of everything, and not crazy hours. So.
And you got your foot in the door.
You got it.
How long have you been practicing?
I've been practicing since 2000. I graduated school in 2000, and then from there I did a 3-year surgical residency, and I've been there ever since.
Wow. People ask me questions all the time, especially when I'm not in my office and when I'm traveling, and they'll say, well, how do you find a good chiropractor? How do you find a good podiatrist if you're new to the area, or if you're saying, look, I have a problem now, and this is probably the person for me. How do you go find a good one?
It's tough this day and age with the internet and all the information we have with the information highways. It's pretty easy to do the Google search, but I think your best thing is word of mouth. Now the tough part is if you move to a new town, you don't really know anybody, so you're going to be getting it from your other professional sources, whether you're a family doctor or your dentist or your chiropractor or another nurse at a hospital. Ask around. We get a lot of patients word of mouth, just referrals that way.
Cool. How do you choose a good shoe? This time of year in my practice, I'm not a flip-flop. I don't really hate them because I should be thankful for them. But I look at the research, I look at the gait, and if they don't have a good contact with the foot and the ground and the ankle and the knee, I know it's just a matter of time. And when they're young, it doesn't. The symptoms don't last long.
Not at all.
Tell me what you see, and how do you choose a good shoe?
Well, basically, with the good shoe, your mother might have used to tell you, put on a shoe, and you might tell her it hurts, and she tells you just got to break it in. That's not true. A shoe should feel good the minute you put it on. You want a good arch support. You want a good hold on the heel. Laces are preferred. Some people can get away with slip-ons and the backless clogs, but the biggest thing I see is control of the arch and the heel. That's where a lot of the problems come from, the ankle joint on all the way up to the back and neck.
I like that. It's nice because we co-care with a lot of people. We have a physical therapist over here too, and I've brought people over at his office and said, hey Doc, when you have some time, can Rachel set up an appointment and just give me some input because I need some help, and I'd appreciate your opinion on this. Shoes. Are there any brands, I guess brands might be a bad term perhaps, are there any kinds of shoes other than the flip-flops that you want people to stay away from, or?
High-heeled shoes, they're starting to come back in style for a lot of younger women. Anything over 2 inches, you're going to be looking at problems in the forefoot, and makes a lot more susceptible to ankle sprains. So I'm not a big fan of high-heeled shoes, although they do keep me in business.
Well, exactly. And there's a time for that stuff, but, it does create its problems too. Let me see. Do you work on a lot of kids?
I do, actually. I've been seeing more and more kids. I've been up in Libertyville here now about 4 years, coming up on 4 years. And we do see a lot of kids for just mostly simple orthopedic in-toeing flat foot. Occasionally we get a mother who's concerned about clumsiness with the kid playing sports, but we are starting to see more and more kids. And then we obviously have the usual ingrown toenails, infections playing out in the yard, garden, splinters, that kind of stuff. So.
Cool.
Quite a few.
Doc, if folks would like to get more information about you, do you have a website or do you have a phone number
I
that
do.
you'd like to?
Our website is www.laafc.com or libertyvilleankleandfootclinic.com. And our phone number is 847-362-1320.
Hey, Doc, thanks so much for taking time out of your day and doing this.
Thanks, Dr. Segal. Appreciate it.
Thanks again.